How is everybody? Keith Norris here, co-founder of Paleo FX and your host for Health Hacker FX, the insider's guide to biohacking, genetics, and personalized medicine. In this episode, I have Dr. Dan Engle. Dr. Dan is board certified in psychiatry and neurology with a clinical practice that combines functional medicine, integrative psychiatry, neurocognitive restoration, and peak performance methods. Dan Engle, how are you doing, sir?
I'm good, Keith. Good to be with you again, man.
Yeah, man, it's good to reconnect with you. I've always loved your work, and we have another connection too, in that we're both from San Antonio, which is interesting.
Yes, indeed. Well, I haven't been back to San Antonio in a while.
Wow, it's I don't know when you were back there last, but it's grown quite a bit. I can tell you that.
Yeah, I don't think I've been back to San Antonio since I left after I graduated medical school. That was like 20 years ago.
Yeah, you would not recognize it. I can tell you that. You
Yeah.
would not. It's changed totally. And I apologize to all the health hackers out there that it looks like I'm speaking from out of a cave. I am, in fact, in one of my former gyms in Austin, Texas. They're nice enough to A, let me work out whenever I want, and B, if it's clear, I can do a podcast. And right now we are moving both our offices and our home in Austin, so both are in disarray. So I'm trying to scramble to find both A, podcasting, and B, video casting opportunities. So there's that. We're making it work, though. We are making it work.
Yes, the show goes on.
The show goes on. It always does. So Dan, give us a insider's look at what brought Dr. Dan to where he is right now. What was it that when you were younger, what fueled this interest in what you do?
Yeah, it's a great question, and I suppose the maybe the 2-minute version of that would be I didn't actually grow up anticipating going into medicine. I grew up playing soccer and competitive sports, went to college to play soccer. Halfway through college, my advisor asked me what I wanted to do, and I was like, I don't know. I think I'll just keep playing. And it just happened to be I was at a college with a great pre-med program, so I started studying more and more science. It was a good fit. Excelled in that. Thought I was going to go into emergency room care, ER care, or surgical care. And then I broke my neck 2 weeks before medical school. And so I started medical school, screwed in with this big halo.
Wow.
For like the first 3 months, which was really awesome.
Well, how did you break your neck? That's the...
Good question. I was Dallas. You're being from San Antonio, Corpus Christi, Port Aransas,
Sure.
Right? So I was down in Rockport and was going to go fishing with some buddies, and I had been fishing there yearly for the previous 3 years, and for some reason I totally forgot that it was you can walk halfway across the Gulf because it's only like a few feet deep.
Right.
And I dove off a pier with my hands like this. But I've never even dove into a pool like that. So the first thing to hit in knee-high water was my crown.
Wow.
And it was this axial load, so I had a compression fracture, a C5. And it was totally scripted. It was exactly what needed to happen. Because at that point, I went into psychiatry and neurology, got really curious about the mind and neurologic rehabilitation. And those have been kind of the staples of what I do now. And with psychiatry and integrative psychiatry and plant medicine psychiatry and psychedelic psychiatry, there's an entire field that's growing to shift the landscape of how we interact with traditional medicines and the new synthetics to really help heal the big psychiatric conditions that we don't know what to do with.
Right.
Like resist chronic depression, anxiety, PTSD, addiction, and pain. And the medicines are really good for each of those conditions when we know how to use them well. And then I also got curious about neurology because I started med school in this big halo, and I was like, wow, I just really dodged a bullet. And I'm super glad that I can walk around and wipe my own ass and like function. So what is it about my rehabilitative process that's different from others, and how can I give back? I was really gifted with this opportunity to get really close to a major injury, and I've been curious about neurologic recovery and rehabilitation ever since. So right now I'm medically directing a center called Revive Treatment Centers outside of Denver, and our specialization is in concussion recovery, stroke recovery, and traumatic brain injury.
Wow, that's super interesting. So I would imagine in your early days in the psychiatry, that plant medicines just weren't common knowledge or common language. So how did this come into your life?
Right. Another good question. That's another part of the story. So I went into psychiatry. I did my residency in psychiatry, did 2 fellowships, one in child psychiatry, one in forensic psychiatry. And, I just didn't like how we were practicing psychiatry because it was mostly pharmaceutical based. Mm-hmm. And so I started a practice in integrative psychiatry, more holistic medicine, to help people get off of psychiatric medications with targeted supplements, lifestyle management. And that was great. We were doing great work, but it was still it wasn't all of the magic that I didn't even know I was looking for. And I was at a point in my life where I was looking for something else to jump into. And I happened to be introduced to an ayahuasca circle. And in one weekend with ayahuasca, I learned more about myself than I had in 1 decade of psychotherapy. And I was like, holy cow. This makes everything else I was learning about psychiatry seem like kindergarten.
Right.
So I, over the course of about 2 years, closed up my practice and moved down from Portland to the jungle and lived in the Peruvian Amazon jungle for about a year and a half, and apprenticed with the medicines and just dove deep into ayahuasca. And I studied with only ayahuasca for about 8 years.
Now, how did this come on your radar? Because I'm assuming this is like late 90s that this is, and it's only just now within the last few years that plant medicines and ayahuasca have become more mainstream, and there's still swaths of people who have never heard of it, have no idea of it, and I would imagine that's true on the clinical side as well. So how did this come onto your radar?
Yeah, this was about 2005 or 2006. And I was introduced to an underground circle through a friend of mine. And I was practicing Buddhism and Native American medicine and was deep into some spiritual practices. And this was my best friend at the time. He could just tell that I was looking for something else. And he had been involved in this circle for a while. So he introduced me to it, thankfully. And I knew from that first weekend on that this was a path that I was going to take for the rest of my life.
Yeah. So you traveled down to Peru, I would imagine, is where you. Yep. And how long were you in Peru?
About 15 months, plus or minus, a little bit between a year and a half. And it was a pretty deep dive. With it, for example, in one center that I was apprenticing, we would drink 6 nights a week, and our off nights were Saturday. So it was a lot of medicine.
Yeah.
And there was just so much information, so much clarity, and there's that rabbit hole runs really deep. And I was curious. The reason I got so curious about living down there and training with the facilitators is I really wanted to understand how they work with the medicines. It was very different than how we work with the medicines. Mm-hmm. We don't, even many herbalists here in kind of our culture, we're not really establishing a primary relationship with that plant intelligence. And everything has consciousness, and plants have consciousness. And when we understand their medicine and we understand how they do what they do, then we can get more sophisticated and masterful in how to use that plant and its essence and its pharmacopoeia of benefit for which person at which time and in which sequence with other modalities. Mm-hmm. And so I was just fascinated by how these providers in the Amazon forest would work with the medicines, because theirs was more on the subtle realms and on the energetic realms, and looking at the spirit of the plant itself and how it does what it does. And ayahuasca has a very clear spirit of cleansing and purification, and she can be she's usually described as this feminine presence. She can be kind of stern in giving us the directives of what are important for us to clean up in our lives. And she can also be a really loving and nurturing mother. And she's oftentimes described as a mother or a grandmother kind of figure. And the mother being kind of like the stern, but in a loving way, like the tough love, like you got to really clean this part up. And the grandmother being like the really nourishing, nurturing aspect. And I have traveled pretty deep with that medicine. She continues to be one of my primary teachers. And I'm still fascinated and really enjoying the opportunity to consult with ayahuasca centers worldwide and to help them develop their programs to be more aligned with the Western mind and bring it into a bit of a more contemporary model. Mm-hmm. And that doesn't mean to make the tradition wrong or outdated. It just means to help evolve the tradition. We need to be understanding of where the medicine comes from, mindful in our sustainability and how we harvest it and how we use it. And then when we as privileged people, in my opinion, to be able to work with this medicine, it's up to us to do the work on the other side in integration. Yep. So we're really harvesting and utilizing as much of that experience as possible with as little necessity to go straight back into it to get like another quick fix. We're so used to that in our culture, getting the quick fix. And this isn't about, and the medicines aren't about fixing anything.
Right.
Medicines are about showing us truth and giving us clear direction to how to lead a better life and to be more fulfilled and a more whole person. So they oftentimes tell us what to do, and it's up to us to do it. It's still our work to do.
And I think that's probably the biggest leap, at least what I've seen from Western culture using these medicines, is Western culture is still in the, I take a substance, that substance fixes me. Mm-hmm. Whereas this substance doesn't fix anything. In fact, you may have more work to do when you leave than when you went in. Right. And it's on you to actually do the work. And I would imagine this is where your practice then really comes in, because I would assume that with the people you work with, you are the one that is leading the charge on the integration and the ongoing integration.
Mm-hmm. Yeah, that's a lot of work that I'm doing now individually and with groups, is helping to solidify that experience and make it workable for a person's life. Like, how do they use that experience? It's kind of like taking your yoga off the mat or your meditation off the cushion and making it more workable and consistent, and also being a part of that accountability team. Kind of like you, as you know, if you're in the role as a coach or as a trainer, one of the best things that we can do is hold our clients accountable.
Right.
And if they know really clearly what they've been directed to do or what they need to clean up or like the next step, it can be helpful to have that accountability process. And medicine right now is in this bit of a gray area, particularly with something like ayahuasca, in that it's not legal. It's still officially stuck in Schedule 1, which is a misclassification. Mm. Schedule 1 drugs mean that there's a high abuse potential, a high addictive potential, and there's no known medical benefit. And ayahuasca fails on both accounts. It's right. Very good for helping people with addiction, and it has clear medical benefit beyond just the mind. There's great physiologic benefit too. And so there is this misclassification, but the feds right now aren't prosecuting because they've lost 2 landmark cases, one with the Native American Church for peyote and the other for the Santo Daime Church with ayahuasca in a very particular religious context. And my understanding is that they lost a 3rd case, then that would set precedents for legalization or at least criminalization. So it is in this gray area. Ayahuasca is one of these unique medicines too, because it is, it's very esoteric in many ways in how it's formulated. So in like the classic traditions, it's made in the jungle with a lot of admixture plants. The way that we would be able to utilize that in a more like legal framework would be if we were able to establish consistent purity and potency in the brew. And I think that that's possible. However, if we tinker with it too much and make it too synthetic, then we lose some of the magic.
Right.
That's not to say that things like with ibogaine, which you and I spoke about before, ibogaine is the primary synthetic from iboga. And even though it's not the whole plant, it's still massively supportive for people's recovery from addiction. So we're in this really exciting phase of how we have this like next wave of psychedelic renaissance and resurgence, and Michael Pollan's book, How to Change Your Mind, and people actually having more above board conversations, both politically and medically, about the right use of the medicines, and this resurgence from the 50s, 60s, and 70s that's now happening again in the medical research.
Do you worry about the and I'm sure you do. So I'm teeing this question up I'm teeing it up this way. So do you worry about oversynthesis of these materials? So there is, and I understand for people who have not done plant medicines, this statement may sound crazy or weird or woo or whatever, but there is an essence in that mixture that I don't think can be replicated if it's synthesized too much. And maybe you can compare a natural ayahuasca brew that's done in the jungle or under those conditions, under the direction of a shaman, versus something like LSD, which is synthesized in a lab. And both are beneficial, or can be beneficial, for making intellectual, psychological, spiritual breakthroughs. But having done plenty of both, I have always felt a very synthetic feel from LSD. And so there was none of that mothering feel. It was very technical, I think, is the best way I can put it. And maybe that was a message from my subconscious, because I knew it was a synthetic, and maybe these are stories that I'm telling myself. I don't know. And I'm totally, I'm totally down for that being the case. But I do know what I felt. I do know what I have felt using plant medicines, and I do know what I have felt using a synthetic drug.
Yeah.
And I know they're different. So can you speak to that from a clinician standpoint?
Yeah, for sure. So I'll answer it in a couple of ways. So if we are using natural-based medicines and we're synthesizing them in a lab, then we're altering their native structure, their native essence. There can still be benefit. And then the analogy that I'll use in this example is if I'm getting a hands-on massage versus sitting in like a massage chair. And this machine is working me, even if it's a really good massage chair. And I've had great massages in massage chair,
right,
and I'm still going to prefer that human contact. There's just a difference about it. It's more of an engagement and like a reciprocal dance. And with something being synthesized, for example, we just talked about ibogaine, it can still have massive benefit. And I've done both iboga and ibogaine, and I experienced them to be different. And with something like the synthetics, LSD, MDMA, ketamine are the big three that are kind of like on the block. And there's a lot of different LSD analogs and MDMA analogs. Ketamine's such a unique molecule by itself, but they're all synthetic. Many, if not all of those, have such an effect in the mind, and a little bit less effect like physiologically in the whole body,
right,
like, our whole being.
Yeah.
And which is excellent to the extent that this is where I think the medicines have their best place, is to help heal our mind and help heal the distortions and the false negative belief systems and the transgenerational trauma and like everything that we just have up here that's not our divine blueprint, so to speak. And I think in many ways the synthetics make more sense to roll out and to scale out, because the natural medicines are really threatened right now, because they're not being sustainably harvested.
Right.
So the ayahuasca vines and tracts of land are becoming more and more thin. Peyote's been endangered for decades. San Pedro's now having that same thing happen. Iboga, like 95% of the world's iboga was it was harvested within a 3 to 5 year period and gone. So they've had to now go from iboga to a cousin plant called voa conga, which has ibogaine still as the primary synthetic alkaloid, just like peyote and San Pedro cactus are cousins because they're both mescaline based.
Right.
And so to the extent that I think supply chains are super important to be mindful of, it in many ways makes sense that the synthetics would be on board to be scaled and rolled out. The exception to that in the natural plant medicine arena is psilocybin, because psilocybin is so easy to grow.
Right.
And, you could grow it in your own kind of basement lab. as long as you have the right conditions and perfected the model. It can also be grown in huge networks of the mycelial networks naturally and in grow houses, kind of like cannabis is grown. So in many ways, I think that there are ways that we can be really mindful about how we roll these out just in a sustainability arena, and then also in a political and governmental arena. And this is where it gets even more exciting kind of to engage the conversation, because some people are really excited and would go for decriminalization. Other people would be more restrictive in how the medicines are rolled out, maybe going from Schedule 1 to Schedule 2 or 3, which means that you would still need a physician's prescription if you met a certain medical condition, and that you would receive that medicine in a facility that was registered and licensed and known to be doing good work with trained facilitators, kind of like how medical marijuana came online before recreational marijuana came online. And I think there's something to be said for that. And the reason being is because I have had the opportunity myself and then to work with thousands of friends, family, and clients who have a very different experience in a recreational environment versus a therapeutic environment with the same medicine. Right. So if we're going for deep work, if we're going, particularly in my background in psychiatry, and I get excited about how we can help psychiatry take its next evolutionary leap, if we're going for the easing individual and collective suffering from depression, anxiety, addiction, PTSD, and pain, there are millions of people suffering needlessly because these medicines are stuck in Schedule 1, and we have yet to, because of the lack of research, because of that misclassification, we've yet to really formalize a good practice to be able to scale out the delivery of these medicines to the people that need them the most. So right now, most of the people that are able to receive these medicines do it underground, out of pocket. Yep. So you've got an access issue and you have a financial issue. And that leaves 90% of the population out. And yet that's actually, they make up a larger demographic of the people that are actually suffering. And so I think our work is cut out for us, but that's what I'm here to do. I've been groomed to be in this position, and I can't think of a more exciting arena to be in than in this arena of medicine, because it's starting to take its next evolution as a grassroots movement, and people are understanding the research, and the research is so good. So when I talk to a medical community or do a grand rounds lecture, I roll in and I say, I'm not here to, first of all, I'm not here to sell you on anything. I'm just here to give you data. And if you are taking the oath seriously as a medical provider, then you should be engaged in understanding the data from as much of an unbiased, non-judgmental perspective as possible. So if we're able to agree on that, put all your judgment aside and let me just give you the data just speaks for itself. And then there's no selling that needs to even happen.
What has the reception been like so far?
It's been pretty good. I take my dad as a classic example. My dad, self-made, kind of the Marlboro Man, CIA agent archetype combined, super skeptical. Yeah. And he and I had it out, over when I went down to the jungle, he thought I had completely gone off my rocker. Sure. And particularly when I went back a second time, he's like, oh my gosh, I don't know what to think. And so after a few years, and my little sister, and she wouldn't mind if I share this, and I'm super proud of her recovery. My little sister was having a hard time with alcohol. Mm-hmm. And she tried a variety of different things, and my dad knew I was involved in this plant medicine research down south. So I took my little sister down south, down to Peru, to engage this kind of work, and that was massively supportive for her recovery. And at that point, it really got his interest, and then we started having a conversation about the other medicines. What is the medicine about MDMA research, psilocybin research, ayahuasca research? The list goes on. And then after having a few-hour discussion, he was like, whoa, I really understand now why you do what you do. I'm still a no, My dad's never even smoked a J.
Yeah.
Like, I'm still in no because I'm not ready to lose control. And I was like, that's great. At least now you can make an educated choice.
Yeah.
And so from that place, that's all I'm desiring to do is just give people data so that they can make their own educated choice. Even the medical community, because not everybody's going to be a medicine facilitator. And some people are going to be so skeptical that they really want to see like the large population-based randomized control trials.
Right.
That these kind of medicines don't really work in that kind of system.
Yeah.
But at least we're engaging people in the conversation. And so from that perspective, I'll have, when I go into that kind of arena, most are skeptical. Most psychiatrists right now are skeptical, or at least a few years ago were skeptical about medicine work. And when I would leave a lecture and just give them the data, most were either curious to know more, or they had enough resonance to get a sense that that was true, and they were wanting to pursue even more training on their own. So it only takes a little bit of information delivered in that kind of like unbiased way, and the data, because it's so good. For example, I was running an Ibogaine clinic in Mexico as a medical director for about a year or so, and the recovery rate for Ibogaine for heroin use is somewhere between 60 and 80%. One-time use.
Which is incredible. Absolutely incredible.
Right. Compared to the standard of care.
Yeah.
And that data has been replicated, and it's been shown to be consistent. Yes, we're going to do larger population-based studies, and yet the data that we have has consistently shown that when the integration support is helpful and the lifestyle management happens, like moving into sober living situation, staying away from friends and like the social network that's still using.
Yep.
When that kind of support is there, the reboot that happens with Ibogaine is phenomenal. And there were thousands of case reports of people getting sober with LSD from alcohol use in the 50s. From the same kind of arena, most people had a significant experience. Most people went further towards their recovery through an LSD experience than not. Bill Wilson being one of those, who was the founder of AA. So all of this research that was done back then is now becoming relevant again. And we bring that data in a contemporary model with the recent data, and the data is just super good.
So, Dan, what is it about these substances that puts you in the position to be able to make a change like that? So I will just say, anecdotally, I have seen severe depressions reversed. I've seen addictions to various drugs and alcohol gone. And it's, and I say that to people that aren't familiar with these substances, and it's like oh yeah kind of thing. But I'm like, I've seen it. I have seen it up close and personal. I know these people. I know what they were like before, and I've seen the transition. And again, it wasn't pull your car into the shop and get the brakes fixed and pull out. They had to do serious work on the back end.
Right.
But whatever it was that they went through, whatever realm they were allowed to see or they went to, allowed them to take that first step and say, either I am not that depressed person, I don't have to identify with that and I make a change, or I am not that person who is dependent upon whatever substance it is. And I'm just wondering, what is it in the psyche that makes that switch? So, and I will say this too, that in various ceremonies, I have been told by Mother Aya that, you can do this on your own. I'm happy to help you out and show you this, but you can do this on your own.
Right.
And I have been like, yeah, I don't think so, but no, you can do this. So I know that ability is latent within all of us, but I'm just wondering what the medicines do to peel back the curtain to allow us to see that.
Yeah, you brought up two really good points, which is how they work in the psyche to create change, and the fact that we have this inherent ability within all of us, oftentimes laying dormant and ready to be exposed and utilized again. So I'll take those one at a time.
Right.
In regards to the shift in the mind stream, I see the medicines as being catalysts for consciousness. And in chemistry, if you have a number of ingredients that are going to go through a particular reaction to create a new substance, that process happens in its own accord and can be sped up and stimulated, and oftentimes is required to be stimulated by a catalyst, which means something that comes in and speeds up the process significantly or helps to create a process that wouldn't have otherwise happened. So as such, they come in and they create this pattern interrupt. And I liken it to an operating system in a computer. So if we're running an old operating system, a faulty program, a negative belief system, something that we adopted from our childhood or from the culture at large or from our ancestors, trauma is passed on genetically from generation to generation. We know that. We've seen that. It's been replicated. So is it my stuff? Oftentimes it's not our stuff. Well, it is our stuff. Maybe it didn't come from us. Right. A lot of what we clear, maybe its inception point didn't start with me, but it's still in me and it's still a part of my psyche. So whatever that program is, the medicines give us oftentimes this opportunity to get some distance from it. Our default mode network goes quiet or a little bit offline, which is like the dominant operating system that we usually engage the world with, the ego's dominant operating system. That goes offline enough, and the fear centers calm enough that we get a new perspective of something that was just right behind the curtain. So whatever was in the subconscious comes online. And it's whatever was right on top. And usually we don't know what that's going to be. So somebody might have an intention to have a particular healing in the medicine space, and yet something very different often and usually does happen, right? We can't predict what's going to happen.
Right.
But we can recognize that oftentimes the medicine space is constructed. And what that means is it's reflected in the set and the setting and the expectation going in. So in the 50s, when they were doing all these LSD trials, and therapists were actually given free LSD by Sandoz, the pharmaceutical company that was trying to figure out how this thing was doing what it was doing. This was like widespread open trial in mass for LSD. It was amazing. And that's why we have so much literature and data on it. They were noticing that people that had an idea that they were going to go in with a really beautiful experience and beautiful healing, even if it was uncomfortable, they tended to have that more transformative, maybe like positive experience. Other people, if they had the idea that they were going to go in and have what was first classified LSD in this term called psychomimetic, which means that it's psychosis-like. So there was a whole arena of therapists that saw LSD as just creating psychosis and creating madness, and you had to create the madness and go through the madness in order to get the healing. So if people had an idea that they were going to get crazy, then they usually did, and that would be kind of like today's nomenclature described as a bad trip or a negative experience. So that can oftentimes be constructed. So if we have an idea that healing is going to happen, if we have the intention that healing is going to happen, oftentimes we don't know what's going to come up or what was just like on the surface now to come online. And we have enough of the fear center relaxed and the default mode relaxed, the old operating system, to get a new perspective and to get a better kind of view more accurately about actually what's happening or what happened, and now how we can utilize that information to make more informed choices moving forward. Oftentimes that's how Iboga is classically described. It gives you this life review. You go through kind of like with Aya too, you go through the DMT wormhole and see all the visuals. And traditionally, that's why ayahuasca is not called chacruna, right? Ayahuasca is the combination of two plants, and ayahuasca is the MAOI. It's not the DMT. right? So the DMT is classically what causes the visions. The MAOI is what prevents the DMT from getting broken down. Well, it's called ayahuasca because the healing doesn't happen in all the sparklies. The healing happens in deep truth.
Right.
And that's more of what ayahuasca is kind of like noted for, and Iboga is noted for. So when you go through the psychedelic kind of wormhole, then you open up into the truth landscape. And that's where I think, kind of like Einstein said, we can't solve a problem using the same mindset that created it.
Right.
We have to have a new mindset. And so these medicines catalyze that new mindset, new perspective, truth to be experienced. And sometimes it's internal truth, right? It's like, oh, I knew that person wasn't right for me, or I knew that job wasn't right, or I knew that drug thing I've been doing isn't working for me. And sometimes that's truth externally, whether it's truth that comes like from the plants, truth that comes from the greater noetic truth, Noetic. Noetic is like this bigger truth beyond just the little I in here, but like the large truth. Wherever that comes from, people oftentimes feel it either internally or externally, but they recognize it as truth. And then at that point, our opportunity as facilitators for integration is to help them get clear on that truth, stay consistent with that truth, and then make decisions according to now what would be a more like whole person perspective. And I'm still a fan of encouraging people, don't make drastic changes like within 2 weeks of a big medicine experience. Because we want to make sure that the choices are also workable,
right,
and integrated within the rest of the life landscape. So there is a dance there, and I haven't seen, other than near-death experience, right, which is a little harder to control than like a psychedelic experience.
Right.
I haven't seen anything else available for the Western mind to get out of its delusion, to come back to love, to come back to equanimity and community and connectivity and cooperation versus like competitiveness and me, mine, and I and consumption. And we see how unsustainable on the planet that is. So I haven't seen any other methodology that is as effective, efficient, or safe for helping us get clear with that truth.
Right. And would you say that there's different levels here? So maybe the way I see it, you correct me, feel free to correct me if you're wrong, but kind of entry level, of course, dose dependent, LSD, psilocybin, and then you kind of take a step up to ayahuasca, and then maybe another step up to iboga.
Yeah.
And that's...
Yeah, I think that's a mindful kind of classification. Mm. I think of it as like level 1, 2, 3, 4 experience. And even below that is like flotation therapy.
Right. Yeah.
If somebody doesn't have an experience with medicine, I say go float first, because if you can't hold your stuff together in a tank,
right,
really
I would
hold it together in a therapy. And then level 1 is like recreational use. And that's what a lot of people will have their first entry into. Hopefully it's not traumatic. And there are classic, oftentimes frequent examples of that. Somebody saying like, yeah, I had a mushroom trip. It was hell. I'll never do that again. Like, well, that was a level 1 experience where you were doing it recreationally and you weren't mindful of like who you were around or the dose that you were taking.
Right.
You were sitting there to help support your process.
It's a whole set and setting thing, right? So
I think of level 1 being the more recreational entry with LSD, MDMA, cannabis even, psilocybin, relatively lower doses. And then level 2 being all of those same medicines at higher doses with facilitation. So now we move from recreational to therapeutic.
Right.
And oftentimes like a recreational dose with psilocybin might be like 1 or 2 grams, whereas a therapeutic dose might be more like 3 or 4 grams. Mm-hmm. All set and setting, and it also depends on the strength of the psilocybin because it does vary quite a bit. So level 2 are those medicines. And level 3, like you said, ayahuasca, San Pedro cactus, peyote, those that come from a traditional background that are typically stronger experiences, last a little bit longer, and have more of like a way of skillfully navigating that because they are plant medicine consciousness. And they do come from that lineage of plant medicine carriers. Those three medicines have thousands of years of history: psilocybin, San Pedro, and ayahuasca, right? And peyote. And so with all of that history, there's a mastery that comes in that facilitation. That's level 3. And then in level 4, I put iboga and 5-MeO-DMT from the Sonoran Desert Toad, which is this like 15-minute experience, but you go into unity.
Right.
Ego, nothing else like 5-MeO from the toad will like invite the ego through its death process. Because the ego has no, if the person's able to cross over with enough safety, because a person can put the locks on, slam on the brakes,
right.
Not cross over if they're not feeling safe enough, or if they don't have enough medicine on board. If they are able to cross over, there's no ego left to even really track what's going on oftentimes. It's unity consciousness. And as such, sometimes people come back and they don't really have any recall. They're just like, wow, I was just melted into the entire experience of the universe and where life came from. Oftentimes people will have a little bit of recall going in right before breakthrough and then coming out. But DMT because it's such a change from the ego, because there's not even a default mode network. There's not even an observing ego.
Right.
It's like, holy cow, I have no frame of reference for anything that this is related to now. Am I ever going to come back? And am I going to be okay when I come back? Really primal fear can lock in. And because of that, because of the strength of the experience, I put that in that level 4, and I caution people to be really freaking mindful that we're ready enough to do that, because there are a lot of people using that medicine pretty liberally, and I think it has, and just to put it in context too, the Sonoran Desert Toad medicine, 5-MeO-DMT, has been used for thousands of years in northern Mexico and in kind of southern Arizona. That's where the Sonoran Desert Toad comes from. These effigies and stone pillars in temples for using this medicine are hundreds, if not thousands of years old. And people would pilgrim on foot up to 1,000 miles to experience this medicine one time in their entire lifetime.
Right.
That's how much it was revered.
Yeah.
And now people are just walking around with smoke pens and having vape experience. I'm like, man, that's when I get on my soapbox, and I'm like, you have no idea what you're even working with. Right. So let's make sure you're prepped. Last thing we need to do through this medicine work is create more trauma, right? Because that's part of the reason it got stuck in class 1 and in the first place. So I also put iboga in level 4 because it lasts so long. And it also has some cardiac effects or heart effects that you need to be really mindful of, and in order to keep it safe. But yeah, iboga itself lasts about 18 to 36 hours, whereas ibogaine will last a little bit less than that. It's more like 12 to 18 hours, and it's a freaking hell of a ride.
Yeah.
Super into. Have you experienced?
I have not. I'm due.
Yeah.
I have a retreat set up, so.
Oh, wonderful. It's an amazing medicine. There's nothing quite like it. And the peace of mind that I experienced on the other side of it is unlike anything I've ever experienced. And it's a fascinating medicine. I mean, anything that has the ability to snap somebody out of a 10+ heroin daily use in one treatment. Yeah. Pretty powerful ally.
It is. And I try to explain to people who have not had a ayahuasca experience or iboga experience that the difference between even a high level LSD or a high level or a high dose psilocybin, what the difference is. And to me, it exponentially, ayahuasca was anyway, exponentially more powerful even than a high dose of either of the other two. and I can't totally explain it other than to tell people that in a very intense ayahuasca experience, I have lost that little voice in the back of my head that says, this is bizarro world, or whatever you're going through is totally strange. But remember that you just took a big dose of LSD, or you just took a big dose of psilocybin. Just keep that in mind. And ayahuasca experiences, I have totally lost that. So whatever realm I am in, good, bad, or indifferent, it might as well be me talking to you right now, as far as me thinking that that's reality, if that makes any sense at all. Mm-hmm. But in that moment, that is my reality. And I don't even question, there's not even anything in the back of my mind to question that.
Yeah.
It's just kind of this odd, that's weird. How did I get here? So, okay, well, okay, here I am. So in my experience has been the difference between an ayahuasca experience and a high dose psilocybin or LSD experience. Mm-hmm. I don't know if that's common or not, but that's just been mine.
Yeah, it's reflective of how the different medicines work. There are different energetic profiles, how they work neurochemically. They're oftentimes done in very different settings. Like ayahuasca will be experienced oftentimes in a very different setting than psilocybin or LSD. And there is a particular essence there. There's a particular flavor of that experience, particularly when you do have enough of the medicine in you in order to cross over, and that usual operating system just goes offline.
Right.
Then you have this ability to have more of that deep sense of like curiosity. I invite people in the medicine space is to get curious. Like, set an intention, drop the expectation, get curious.
Yeah.
Right? Because it's just going to be something that you probably didn't know was there, and it's being offered as a teaching. Yeah. As an ally of some sort. And I also want to just take the moment to say that not everybody's ready for medicine work.
Right.
And I'd be remiss to say that it's great for everybody. That's why I'm not super excited about decriminalization.
Right.
On a broad spectrum. People with a predisposition towards psychosis, mania, already being like disconnected from their lives and not really like anchored here in this realm, not a good idea.
Right.
People with a significant family history or a likelihood that might be present, not a good idea. Or people that are on psychiatric medications, because the pharmaceuticals just don't work really well with altered states of consciousness.
Which is also why it's so extremely important. And if you do this work, you do it with somebody who knows what they're doing, right? And I think that's the other scare too, is the stories that I hear of people using this medicine under it, and the circumstances under which they're using it is just like, don't do that. Do not do that.
Right. Tim, I was talking with Tim Ferriss, either just in conversation or as a part of one of his books. And he was like, yeah, if I'm going to have psychic surgery done, I'm not going to want to go to a med student.
That's
right. Yeah. I'm going to go to somebody who's been doing this for like 10 years and knows how to pull the ripcord if there's crazy happening.
Right.
Knows how to screen people to see where they're ready. Unfortunately, a lot of people are facilitating these experiences because they just feel so called to do it. So now it's becoming a part of their identity.
Yeah.
And it can be really seductive to be in that like facilitator role and be identified as the person that's curing all these people of all their ailments.
Right.
And we as facilitators, we're just a channel. Yep. I'm just a messenger. And the best thing I can do is to make sure that it's a safe space, get out of the way, and intervene when necessary, but only when necessary. Like Miles Davis says, it's the space between the notes.
Right.
So if I can just get out of the way and my expectation that I need to do anything, unless there's trauma happening or like a midwife, right? Like we ancestrally know how to birth babies. It just happens naturally. Everybody does it. All living things do it. And yet it's still helpful to have a midwife, because if the baby's turned, or if the cord's around the neck, or if the mother starts to hemorrhage, I mean, we need to know how to intervene. But usually it's just letting the natural course take its organic unfolding.
Right.
Yeah.
Right. And I think these medicines too, and I was going to say a little bit earlier that the ability for a person to just peel back the layers of the onion back and back and back and back, because I know many people will go in to ceremony with an intention, or they think they know what the problem is.
Mm-hmm.
And inevitably, what they think is a problem is not the problem. It's 10 layers deeper. Oh, that's the problem. And what I thought was the problem is just a reflection of what, the real root of the problem is. And I think that the medicine puts you in this space to be able to dig and dig and dig, or, to look at it another way, that the medicine shows you what reveals to you, or opens up your subconscious so that, like what you said, they can float out and you can actually see it and deal with it. And then if you do the integration properly, now you've just taken off the table all of those resultant issues.
Mm-hmm.
Right. And that, I think, is where people say, one ayahuasca retreat is worth 10 years of psychotherapy, or you've heard various versions of that, but I think that's where that comes from.
Absolutely. Yeah. Well said. That was certainly my experience. And it's one of the things that I appreciate about you bringing this conversation to the table in the context of the paleo conversation, right. the ancestral medicine conversation.
Yeah.
How did we move ancestrally? How did we eat ancestrally? How did we live ancestrally? And what were the medicines that we used ancestrally? Like, right. We are programmed, this is in our blueprint, to be curious, to seek novelty, and to explore areas of transcendence. It's in our hardwire. There's a great book called The Biology of Transcendence by Joseph Chilton Pierce. And he talks about this blueprint that we have for transcendence. And if it doesn't get expressed, then it oftentimes comes out in a distorted way.
Right.
And that can look like violence.
Right.
We're not being fulfilled. We're not moving the energy. We're not doing like what we're here to do, and engage in the things that just feel natural. And when that doesn't happen, it will come out in some kind of like corrupted or distorted expression.
Yeah, I totally agree with that. Well, Dan, let's transition away from healing the mind to optimizing the mind.
Cool.
And so can these same practices be used for optimizing the mind, or is there a different variant that we need to look at?
Absolutely. And that's why, fortunately and unfortunately, a lot of the people that are experiencing the medicine now are like the worried well. Mm-hmm. And I don't even mean that in a negative sense. I mean, it's like, yes, there's a lot of craziness happening in the environment, in our communities, in our politics. All the major institutions are upside down from their optimal expression. Right. Financial institution, the educational institution, agricultural institution, political, medical, all of the major institutions are going through these big fluxes. So we're going to feel that. And what I mean by the worried well is like people with disposable income, like to be able to pay for an underground experience or travel to where it's legal outside of the country. That's already a narrow demographic, right? So oftentimes that's somebody that's working towards optimization, or maybe they're not like ill to the point that they're going to be hospitalized, but they still have one of those 5 primary issues: depression, anxiety, PTSD, addiction, and pain. And so, yes, I think people can go from good to great, as well as, like, I don't like the word broken, but, in a disease-filled state, back to good, and then from good to great.
Right.
So yes, these same methodologies, and I think about when I'm thinking about brain healing and mind healing, I think about it back to the computer analogy. I think about it in terms of hardware and software. So if we're going to upgrade our system, if we're going to upgrade our life, and our brain is essentially our brain is essentially the supercomputer, and our mind is the software system operating that supercomputer. So if we want to up-level our lives, it's great to be able to up-level both at the same time, or like in parallel. So what I see as consciousness technologies are these medicines. And what I see as the cellular technologies is the brain optimization, the actual neural hardware. And we know that these medicines are good for both. They help us orient to new operating systems, adopt new truth patterns of what was there all along, but now we can more like claim as our own, get into an empowerment position, make the decisions that are best for our lives. And they also help heal the brain. So I wrote a book called The Concussion Repair Manual because I had 6 pretty significant concussions of my own, last of which was about 15 years ago, and started having severe post-concussive syndrome. And the neurologists that I was seeing at the time were like, go home, get rest, we hope it gets better. Like, well, that's not satisfactory.
Right.
I've already been resting and it hasn't been better. And you can't give me any solutions? I mean, in the entire field of neurology, we're good at diagnosis, but we're horrible at treatment. So I put myself in the lab and went through as many different neurocognitive restoration practices as I could find. And then what worked, I put in the book. And what had data but that didn't work for me, I still put in the book because maybe it worked for somebody else. Mm-hmm. So I get really curious about like what helps us stimulate brain recovery. And there was a chapter in that book that I actually took out because it was on medicines for concussion recovery. And it's such an inflammatory topic for so many people in the medical community. I took it out because I didn't want them thinking the rest of the book was bullshit.
Right.
And the medicines that are good for brain recovery stimulate new neuronal growth. Yeah. Some stimulate oxygenation, circulation, new neural networks. There's this classic, awesome picture. If you do a Google search for psilocybin effects on the brain, and you do an image search for that, you'll see the classic picture that I'm describing is 2 circles. It's an fMRI, or functional magnetic resonance imaging. And the brain without psilocybin versus the brain with psilocybin. The brain without psilocybin looks like kind of like a spider web with maybe 15, 20% of its spider web lit up. The brain on psilocybin looks like 90% of the cobweb lit up, right? So all of a sudden, you have new neuronal growth patterns. You have new areas of the brain. You have the brain connecting in new ways that it wouldn't have otherwise connected.
Right.
Come online in ways that they wouldn't have otherwise. So that's what I mean by catalyzing consciousness. Mm-hmm. So we know that ketamine, iboga, ayahuasca, psilocybin, they all stimulate what's called brain-derived neurotrophic factor, which means they grow new neurons, right? So we're building new hardware. And oh, by the way, we're also engaging an upgraded software operating system. And so when we do that in concert, now I see neurocognitive medicine and psychiatric neurosciences taking their next evolutionary leap. When we can build in the cellular technologies with the consciousness technologies, we will see a massive shift in how medicine's practiced.
Right. Would these medicines also facilitate myelination as well?
I don't know that I've seen that they actually facilitate secondarily, they'll facilitate myelination because they're stimulating new nerve growth.
Right.
That new nerve growth will get myelinated.
Right.
So this is where we get even more sophisticated. And this is when we evolve the traditions and the use of these medicines to their next evolutionary potential is when we start using nootropics and targeted supplementation that we know stimulate new neuronal growth.
Right.
That could look like a host of things: alpha lipoic acid, the phosphatidyl's choline and serine, acetyl-L-carnitine, creatine, the variety of herbal medicines that stimulate brain function. When we start to use these targeted therapies with new neurologic reparative technologies like we have at Revive, then you can see an acceleration of healing where the parts significantly exceed the sum of their total. Right? So 1 plus 1 starts to equal like 20 and 80 and 1,000. Yeah, this is the leading edge of medicine where we're going.
It just tangentially, I'm just going to drop this out there because it just came into my head. What did you think of Michael Pollan's book?
Awesome. Because he writes from, he's a great writer, and he is a researcher, and he writes from the position of the skeptic. And so it's you can trust him straight away.
Right.
unless you just have like massive judgment and massive bias. And just because this guy's writing about medicine, he must be a quack.
Well, I think too is he's kind of trusted by this, I don't want to say the mainstream because that's not it, but at least a wide swath of people who would otherwise either be against or don't know that much about plant medicines.
Absolutely.
And I think, yeah.
Oh, well, super good point. He's written so many good books about relevant issues.
Yeah.
Right? About what's happening environmentally, what's happening collectively. He's researched them, he's delivered them. They've been really widely received. So he's recognized as somebody who speaks truth and wants to do that well.
Right.
And so he's kind of like, in some ways, the best person to write the next book on medicine work. And I think that's why he's on all the talk shows now, and people are so excited about what he's been sharing. It was only like, I think it was less than 2 weeks after it was released. I was visiting my dad, and my stepmom, she brought it up. She's like, have you heard about this new book called How to Change Your Mind? And I said, cool, yes, I have. How did you hear about it?
Mm-hmm.
She said, well, it's on the ARP reading list, the American Association of Retired People.
Right.
The most conservative reading list around.
Right.
Like, holy cow, we're actually making progress.
Yeah.
This is awesome. Right. And I just like how he presents his experience. He did the research. He had experiences. He was a little bit skeptical of what was happening and why it was happening. And he just has this like transparency and availability to give his own truth on the matter that I think people can really trust. So at that point, again, I just bring it back to like giving people data. Like, let's just engage people in the conversation. We're not selling them on anything. It's just about having more information so that they can make educated choice.
Right.
Yeah.
On the brain optimization side of things, or on the concussion recovery side of things, what do you think of the practice of microdosing, either psilocybin or LSD? And would that help, A, facilitate recovery, or B, provide a cognitive boost?
I think microdosing is an excellent optimization strategy. I don't experience it or haven't experienced it to be as powerful of a healing agent as macro dosing experiences will be. But in the absence of people's readiness or availability to have a macro experience, I know a lot of literature that has shown massive amounts of cases and personal reports of significant improvement in those 5 areas: pain, addiction, PTSD, anxiety, and depression with microdosing. And I've had some great conversations with Jim Fadiman about this. And Jim Fadiman's regarded as like the godfather, so to speak, of microdosing research. And he's been collating globally personal stories of people working in this regard with the medicines for decades. And you can find great amounts of research on his website. And he's also true, because he has a great podcast with Tim Ferriss as well. And he's like, traditionally, people were probably expressing or experiencing the medicines more in the micro arena than in the macro arena.
Right.
Like if you're not foraging for medicine, you're just eating mushrooms, and you're like not necessarily going to blast off, but there's a steady trickle effect.
Right.
And I think there's a really good codified practice of microdosing. Again, the same rules apply. If somebody has a predilection towards psychosis, mania, or are on psychiatric medications, then they should be ultra cautious. But I also know that people have had significant benefit in using microdoses to get off of psychiatric medications. And I'm not promoting that,
right,
the right forum to do that, but it's very curious to me that a lot of people have had that benefit. So the classic protocol is 1/10 of a journey dose every 72 hours.
Mm-hmm.
So essentially you're taking a journey dose and you're spreading it out over the course of a month.
Right.
And then if people are engaging in that, I just invite them to get really clear on what their core symptoms are and track the data. So if it's in a healing arena, if your core symptoms are around depression or melancholy or insomnia or worthlessness, a lack of self-worth or lack of direction, whatever the core symptoms are, track those on a scale of 1 to 10 over the course of a month and see what happens.
Right.
In the optimization arena, there have been some small studies on LSD microdosing that showed a 90+% response rate in optimization cognitively, and just as a nootropic or a brain enhancement would. So increased creativity, increased memory, focus, and concentration, increased sense of being able to stay on task and actually complete projects. So the things that we would want to improve as far as cognitive function goes, it can help in that arena as well. That's why a huge number of CEOs and executives, many of which are in the Silicon Valley Bay Area hub for this research, are working with these medicines in the microdose arena.
Yeah. Austin too. So Austin is kind of a mini Silicon Valley now, or it may turn into the actual Silicon Valley. We have a constant flood moving into Austin.
Absolutely.
But I can tell you from personal experience, and I don't know what this quality is, but from microdosing, in my experience, it is the ability to connect otherwise desperate dots that I would not have been able to connect.
Mm-hmm.
And it's so very hard to explain, but I know it when I feel it and when I see it happen. It was like, how did I connect those dots?
Right.
Or the flip side, how did I not see that before?
Right.
Because then because it seems so obvious at that time. I'm like, oh, well, yeah, this and this, bam, that's perfect.
Yeah.
And it's very, very subtle.
It's like the felt experience of what we were talking about with the psilocybin pictures. When there's new neural patterns in communication, how is that going to be expressed and felt? It's going to be like, oh, wow, now I'm seeing things in a different way, or making this you wouldn't have otherwise done.
Yeah, and it's in one way it's maddening because it's hard to explain to people what that is.
Right.
The other way, I know, I'm like, I don't think I would have seen that 2 years ago. There's no way, even if it were right in front of me, I don't think I would have put those two together or this combination together. But in this instant, it makes perfect sense.
Yeah. That's one of the descriptions too of the macrodose experience or the transcendent experience. William James talked about that in a classic book called The Varieties of Religious Experience. And one of those classic characteristics is something called ineffability, or it's hard to put into words what happened and what is happening. And it's part of the art of somebody like my buddy Aubrey, who you know really well.
Right.
He's got a really good ability to describe his experience in the medicine space. And he's very poetic in that regard. I think that's part of what's built his following as much as it has, because he has a great vocabulary and a languaging. Terence McKenna, very similar. Dennis McKenna, very similar. And when that happens, it's kind of like Terence's definition of a shaman is the person in the tribe or the community that's willing to go to the edge of the known, jump off into the unknown, have an experience, and come back and tell everybody what happened.
Right.
And it's that last piece, it's the telling everybody what happened that helps to make it more relevant for them as well. If I jump off, have an experience, but I can't explain or share it, then maybe it's great for me, but I don't necessarily know primarily or directly, it's not necessarily as available to support other people.
Right. And since you brought up Terence McKenna, his book, Food of the Gods, I think I was a latecomer to Terence McKenna's work, but that was like my maybe first or second introduction to him, which was still one of my favorite books ever.
Absolutely. Yeah, mine too. That was my first book into this entire arena. And he's just, and now listening to some of his talks, and he has just this great cadence in the sound of his voice.
Right.
He just draws you into that space so well and just speaks about it so well.
Right.
And it is in many regards, it is an otherworldly kind of experience, and it doesn't necessarily have to be. And that's where I think we titrate people's readiness to really cross over into that level of transcendence, because that crossing over can be a little disruptive to people's
Right.
operating system. So we just pace it. Get
Right.
in the tank, have some floats, get in touch with the unknown, see what happens, and then take the next step from there.
Right. And floating, seriously, is a fabulous practice. And it is a great lead in because you are totally left alone with you and your monkey mind for a half hour or an hour, however long the float is. And it can be disconcerting for many people at first. For those who are used to it, it's liberating, right? You get in there and the world just shuts off and you go into that meditative place very, very quickly. But I've been in a float center when someone has lost their cookies. it's funny now, but at the time it was like, whoa, that wasn't a pleasant experience for somebody.
Yeah. That's it. And it brings me back to your point too, which is like, we are hardwired to have these experiences and to be able to tap in. Like ayahuasca, she gave you that reflection.
Right.
Everything that's happening right now, you can still do on your own, and it's
Right.
true.
Yeah.
We can reach those states through meditation and through chanting and vision questing and
Right.
fasting. And there's a lot of different practices that open us up to that experience. And so I put medicine as just another option in the buffet
Right.
of options for people to be able to experience their own transcendence, because I think it's important for people to get in touch with that.
Totally. And so what would be, if you could kind of summarize, what would be a concussion protocol for someone? Just say a soccer player like yourself, concussion. What are some of the steps? And I know there's detail for sure within that, but what would a general recovery look like?
Yeah, there is maybe I can offer that. Well, I'll just give you a description. Maybe it's easier for me to do that. So there's things to do, to take, and to avoid immediately after concussion. The things to do would be to get a full evaluation to make sure that by somebody that's trained, to make sure that there's not something else happening that would be really injurious, like a bleed.
Right.
That's the classic. So get a full neurologic examination, do your due diligence. And I need to say that as a medical provider first, because if we miss something, then that's not good. The other things to do are to avoid loud sounds and bright lights and overstimulation, because the nervous system is going to be inflamed. It's going to be ultra sensitive. So that's where like resting makes a lot of sense. Another thing to do is to float. I think flotation and just like insulating the nervous system after a major head injury can be really helpful. And then the things to take would be high dose of fish oil, high dose of CBD. Those are the two things I recommend straight out of the gate. We know that high dose fish oil has a massive neuroreparative effect. JJ Virgin had this experience with her son, Grant, in the hospital.
Right.
And high dose fish oil is like 12 to 18 grams while it's settling and soothing the nervous system. That's not the maintenance dose. The maintenance dose is more like 6 to 9 grams, like half of that. Mm-hmm. And it's important to be able to flood it with as much of an anti-inflammatory support. And that's where we start to remyelate. We really start to rebuild new neuronal pathways. And then CBD helps to do the same thing. It works as an anti-inflammatory agent, and it works as stimulating new neuronal growth. So those two classically are super good. And then other things after that are kind of dependent on people's symptoms. Lithium orotate can be really good, especially if there's like an irritability or a hyperreactivity after a concussion. Vitamin D is classically good just because most people are deficient. And it also works as a pro-hormone and then stimulates and supports other hormones. Melatonin is good, particularly if people have issues with sleep and their sleep architecture has been disrupted. Coming back to like the things to avoid, well, we haven't talked about things to avoid, but things to do, like no bright lights. That also means limit the screen time,
right?
Particularly late at night, right? Because that junk light or blue light really screws up people's circadian rhythms. So melatonin is really helpful for that. Other things, phosphatidylcholine, phosphatidylserine, creatine, alpha-lipoic acid, all those super good. CoQ10. I happen to be a massive fan of CoQ10 because CoQ10, liposomal CoQ10, is probably the most effective thing for me and kind of like how my brain got hardwired after concussion. And I noticed that it settles me and gets me super focused straight away. So as a single agent, I'm a big fan of that. Things to avoid: alcohol, sugar, right? So I encourage people to go more ketogenic, more paleo, limit the grains, because those are inflammatory just by nature for the vast majority of people. Limit the inflammatory foods.
Right.
And then limit probably even the biggest thing to limit is the potential exposure to another head injury.
Right.
And those are all now coming in online as these pro and football, hockey, baseball, basketball return to play protocols. So sitting out for 2 to 3 weeks afterwards, massively important. And then as people are able to engage in the therapeutics that we know restore the brain. So there's a great acupuncturist in Austin, Doug and Vanessa, Tiger Lily Wellness. I'm not necessarily making a plug for them, but I think they're great.
Right.
And I told them, I said, I'm going to give you 6 months. I want to see what acupuncture can do for my brain to heal it. And it was massive to see the benefit so that's just one example. And the chapter in the concussion repair manual on acupuncture was written by my friend who's a naturopath and acupuncturist. And he uses acupuncture as a primary modality. So often acupuncture can be really helpful as a single first agent.
Right.
And then in the book too, not to make a plug for the book, but the book just has so many other good therapeutics for concussion recovery. But that's like, if people did those things just straight out of the gate, they would have an immediate healing response, and they would up-level their opportunity to completely heal from that concussion moving forward.
And there is a genetic predisposition for concussion, or at least what would you call it? The follow-on concussion syndrome. It's an APO4. I can't remember what the allele is. But I was tested for it because I played all the way up through college in football, and of course, now I'm like, holy hell, because looking back on now, I don't know that I ever had, I never had symptoms of like severe headaches, anything that would suggest concussion. But I know there was a number of times just getting my bell rung so severely that I didn't know where I was at, couldn't find myself on the field. It's an interesting aside. So many people don't know that I played defense and called the secondary calls for the defense. There is always a default if whoever that person is, his bell is rung and he can't make the calls. There's a default call. The other people in the secondary, other players see it and they're like, default, this guy's. But I remember, a handful of times trying to figure out what sideline I was supposed to be looking at, or seeing these hand signals that I knew supposed to mean something, or the cards, holding up the cards that I knew were supposed to mean, and it wasn't coming. Totally, for the next couple of plays, just being like, where am I at? Where am I, So there was a number of those instances, and every time I forget where my car keys are or whatever, I'm like, oh, here it is. Here we go.
This is the slippery slope. Oh,
yeah, and we do keep up with each other, the former players, and just kind of keep tabs on everybody just to make sure.
Good. It has to happen that way.
Yeah.
And we see what's happening in the NFL, particularly with CTE, chronic traumatic encephalopathy, early onset dementia after recurrent, successive, short together concussions.
Right.
Fighters, MMA fighters. I just got off the phone with somebody yesterday who her coach is just wrecked from CTE.
Right.
He's been fighting for 20 years. Where the goal is to give the other guy a concussion. Right. And so that's why I put the book together, because I was just I was working with Aubrey on it and a lot of the endorsement team, and the protocols just there's a universality. These things are pretty typical for everybody. Do this, take this, avoid this. So we just put those into the book.
Right.
And your point about an APOE4 allele is a good one. If somebody has that genetic predisposition and they have recurrent concussions, it increases their likelihood of dementia or CTE at least 10 times.
Yeah, that's incredible. I mean, I would almost, if you're going to go into one of those sports, I would, and maybe you would differ, I would highly recommend you have that test. I mean, you really, really need to know that, know what you're up against.
Right. Do the due diligence. At least get that test. And a lot of parents are taking their kids out of competitive sports, including football, because of that potential risk.
Right.
Again, it's kind of like vaccines. You know, there's a lot of data to support that vaccines actually do have side effects and negative ramifications. Same thing with combat sports. So it's kind of an individual decision. And I think the best we can do is at least our due diligence and to have these clear protocols. So that, like with you as a D-back, if you're like, what does that call mean?
Yeah.
Is to have the personal awareness and to have the support from the coaching staff.
Yeah.
If your bell just got rung, that means you had a concussion.
Yeah.
That means if you keep staying in the game and you keep bonking your head, you're exponentially worsening the inflammatory load that your brain's going to have and the long-term negative impact.
Yeah.
And so right now, you know, I played competitive soccer at St. Ed's actually up to and when I saw this stat, it was just so it stopped me in my tracks actually, and it gave me the same kind of concern when you don't find your keys.
Right.
So pro boxers, if they're in the ring and they get slugged hard as they can, it's a 20-pound or so impacts the brain. 20 pounds of force. Soccer players, when they head a full volley, 70 pounds. Over 3 times as much as getting slugged in the face. And I was like, holy, my position as center back, I was heading the ball at least 10, 12 times a game from punts that were sky high.
Right.
It was just that. And then when I saw my brain picture on a SPECT scan, these 2 big tracts right in front were just taken out and looked like Swiss cheese.
Wow.
This whole area was downregulated. And so then I got into hyperbaric oxygen, everything in the concussion repair manual, stem cell research. Stem cells are amazing. Peptide therapy is amazing. These are more of the regenerative medicine program.
Right.
And it's important to have the due diligence and to have the support from the rest of the players and the coaching staff.
Right.
Because the last thing I would do when I was playing would get taken out of a game.
Sure. Yeah.
Even when, you know, I'd get slammed with the volley and I'd be like, which way am I supposed to go? But last thing I would do is go to the sideline and sit down.
Yeah.
So that kind of like mentality that we celebrate that warrior ethos.
Right.
And there's also something to be said about doing that intelligently and thinking about our long-term impact.
Yeah. And as a longtime football fan, I belly ached with everybody, you know, when the rules were changed about, you know, leading with the head, which is how I was taught to tackle, obviously. You know, that's your weapon. Use a weapon, you know. But it has to be done to save the sport. Not just the sport. If anyone's seen the movie Concussion, oh my God. I mean, that just about turned my stomach to watch that movie. And I did not want to watch it for the longest period of time because I knew what it was going to show and what it was going to portray. And, after a long while, finally watched it. And it is agonizing what someone with CTE can go through.
Absolutely.
It's murderous, but,
it's a hell of a way to go. And this is another reason, maybe I'll just wrap up on this. This is one of the main reasons, which I suppose 2 big reasons I got into this field. One was my experience with breaking my neck and then with ayahuasca, brain injury, and then like consciousness.
Right.
The other is watching both of my mom's parents die with severe Alzheimer's and my dad's dad die with severe Parkinson's.
Mm.
So 3 out of 4 of my grandparents died with neurodegenerative conditions. And I saw just how, like you're saying, it's a hell of a way to go. Yeah. And oftentimes it's the hardest on their caregivers.
Right.
You know, and we are seeing an epidemic of increasing numbers of neurodegenerative conditions. It's expected that 150 million people in the next 20 years are going to have Alzheimer's.
Wow. Yeah.
it takes on average 3 to 4 caregivers to provide full-time support. So that's 500 million people that are going to be in the caregiving role.
Right.
So we've got our opportunity here to share this information, and make the neuroregenerative medicines, the hardware, more available to people.
Right.
Also the software, the consciousness regenerative technologies available. And when we do that more and more, I think we're just going to go through this renaissance, not only in psychiatry, but also neurology, and not only individually, but also culturally. So that through these experiences, we do find more connection with one another. We do come back to that place of peace and love and a sense of abundance.
Right.
As opposed to a sense of scarcity, like I got to get mine before somebody else does. Like, we see how that's really got us pretty out of whack with all of the other species on the planet. We as the apex species think that it's like, this is only our home and everybody else is secondary. And I think that I consistently see this for people going through the medicine space and going through these transformative and transcendent experiences. They come back into a place of generosity and connection and what we would describe as love. And that's what we're hardwired to do.
Right. No, you really see your place in the big system. I guess you see where you fit and how everything is interrelated. It's a humbling experience for anybody. I would, in one way, I wish everybody could go through it. Mm-hmm. Starting in Washington and kind of
right.
out, but I realize it is not for everybody.
Yeah.
But yeah, how you can come to that realization, whether it be with plant medicine or whatever spiritual practice is, highly, highly recommended. Dan, how can people get up with you and find out more about what you do?
Yeah, thanks for asking, Keith. So we talked about the book, and if anybody's curious to get the book, concussionrepairmanual.com. And we're also in the midst of launching a webinar series for brain optimization. It's called BOLD, Brain Optimization and Lifestyle Design. Right now, we're in a small group launch that's happening. We're halfway through that, and we're going to relaunch it in the coming months. That will also be under Concussion Repair Manual, so you can access BOLD through that. DrDaneEngle.com is just about more of what I do in facilitating support for clients. FullSpectrumMedicine.com is our education and advocacy platform to support people's knowledge about the right place of these kind of medicines in the larger medical context. And they're in Revive Treatment Centers, or ReviveCenters.net is the neurologic recovery center that I'm medically directing outside of Denver, led by a excellent suite of functional neurologists and chiropractors. And our focus there is to help people with severe concussion, TBI, get back online. So that's a little bit about what I'm up to. And as always, totally support and celebrate what you're up to, and look forward to seeing you next in person, and supporting PaleoFX and Health Hacker and anything else I can do to support your mission. Just let me know.
Absolutely. Well, Dan, I know you've got to run. You've got a world to save and people to help. And for all the health hackers out there, thank you very much for taking time out of your day to come on and speak with us. It was fabulous as always.
Yeah, very welcome, Keith. Totally.
All right, Dan.